You glance into the toilet bowl and quickly flush, never realizing that the colors you're seeing could be your body's most urgent distress signals. While most people dismiss their stool's appearance as unimportant, medical experts know that poop color can provide crucial early warnings about conditions ranging from internal bleeding to cancer. Today, we're decoding these hidden messages, and what you learn in the next few minutes might just save your life. The silent language of your stool. Why color matters more than you think. Your digestive system is a complex processing plant, and your stool is the final product that reveals everything about what's happening inside. The color of your poop is determined by multiple factors: bile production from your liver, the speed of intestinal transit, the foods you've eaten, and potential bleeding anywhere along your digestive tract. When something goes wrong internally, your stool color often changes long before you feel other symptoms. Understanding this visual language gives you a powerful advantage in catching serious health issues at their earliest, most treatable stages. Brown, the gold standard of digestive health. Before we dive into why brown poop is the ideal color, I want to share something important with you. Right now, 99% of people watching this are learning about these crucial health signals without being subscribed to our channel. We have an exciting goal to reach 10,000 subscribers by the end of this month, and we genuinely need your help to get there. If you're finding this information valuable and want to learn more about understanding your body's warning signs, please show your support. Hit that subscribe button and like this video right now. You'll be joining a community dedicated to health awareness, and you'll help us reach more people who need this knowledge. Now, let's talk about what healthy digestion looks like. When you see medium to dark brown stool, you're witnessing the perfect harmony of your digestive system. This ideal color comes from stercobilin, a pigment created when bile produced by your liver to digest fats interacts with gut bacteria. Brown poop indicates why proper bile production and flow. Healthy gut bacteria balance. Normal digestion speed, efficient nutrient absorption. Think of brown as your digestive system's way of giving you a thumbs up. If this is your usual color, your basic digestive processes are functioning as they should. Green, the mystery shade that demands attention. Green stool can be completely harmless or a significant warning sign depending on the context. The innocent causes include eating large amounts of leafy greens, green food coloring, or iron supplements, taking certain antibiotics or medications. However, when green appears unexpectedly and persistently, it signals that food is moving through your intestines too rapidly, a condition called decreased transit time. This prevents bile from being properly broken down into brown pigments. Concerning causes include bacterial infections like salmonella, inflammatory bowel disease, celiac disease, parasitic infections. When to worry. If green stool accompanies diarrhea, cramping, or fever, or persists beyond 2 to 3 days without dietary explanations. Yellow, the greasy warning sign. You must never ignore. Yellow, greasy, foul-smelling stool that floats and is difficult to flush represents one of the most concerning poop colors. This combination typically indicates steatorrhea, excess fat in your stool, meaning your body isn't properly digesting fats. Potential causes include pancreatic insufficiency. Your pancreas isn't producing enough digestive enzymes. Gallbladder issues, blocked bile ducts or gallstones preventing fat digestion. Celiac disease, damaged intestinal lining impairing nutrient absorption. Small intestinal bacterial overgrowth. SIBO, Giardia infection. The medical rule, yellow plus greasy plus smelly equals doctor appointment. This combination strongly suggests malabsorption that can lead to vitamin deficiencies and serious health complications if untreated. Black, the upper GI bleeding emergency. Black tarry stool, medically called melena, with a distinctive foul odor often indicates bleeding in your upper gastrointestinal tract. The black color comes from blood being digested as it passes through your system. Critical causes include peptic ulcers, esophageal varices, dilated veins that can rupture, gastritis, stomach inflammation, stomach or esophageal cancer. Important distinction: if you've taken iron supplements, bismuth medications like Pepto-Bismol, or eaten large amounts of blueberries, your stool may temporarily darken. True melena has a sticky tar-like consistency and unforgettable odor. Emergency response: if you have black stool without dietary causes, especially accompanied by dizziness, weakness, or abdominal pain, seek immediate medical attention. Red, the lower GI blood alert. Bright red blood in or on your stool, while alarming, has a broad range of possible causes from minor to serious. Less concerning causes: hemorrhoids, anal fissures. Potentially serious causes: inflammatory bowel disease, Crohn's disease, ulcerative colitis, colon polyps, diverticulosis, colorectal cancer. The critical insight: the location of bleeding often determines the color. Bright red typically means bleeding in the lower colon or rectum, while darker red may indicate higher up in the colon. Medical imperative: any rectal bleeding requires medical evaluation. Don't assume it's just hemorrhoids without proper assessment, especially if you're over 40 or have a family history of colon cancer. White or clay colored. The liver gallbladder distress signal. Pale clay-colored or white stool represents perhaps the most medically significant color change. This indicates a complete or partial blockage of bile flow, which can signal gallstones blocking the bile duct, biliary stricture, narrowing of the bile duct. Liver diseases like hepatitis, cirrhosis, or liver cancer, pancreatic cancer pressing on the bile duct, tumors in the bile system. Why this is urgent: without bile, your body can't properly digest fats or absorb fat-soluble vitamins A, D, E, K, D, E, K. A bile duct blockage can also cause bilirubin buildup, leading to jaundice, yellow skin and eyes. Action required: clay-colored stool demands immediate medical attention. This is not something to wait and see about. Orange, the uncommon but notable hue. While less common, orange stool can indicate excess beta-carotene from foods like carrots, sweet potatoes, or squash. Certain medications, particularly rifampin for tuberculosis, poor absorption of dietary fats, antacids containing aluminum hydroxide. When to be concerned: if orange stool persists without dietary causes or accompanies other digestive symptoms, discuss it with your healthcare provider. The Poop Color Decision Guide: when to seek help. Use this quick reference to determine your next steps. Seek immediate emergency care. Black terry stool without iron supplements. Maroon or dark red stool. White or clay-colored stool. Any color change accompanied by fainting, severe pain, or vomiting blood. Schedule a prompt doctor's appointment. Yellow, greasy, foul-smelling stool. Persistent bright red blood, green stool with fever, cramps, or lasting more than 3 days. Any color change lasting beyond 2 bowel movements. Monitor and adjust. Temporary color changes after eating colorful foods. Single episode of unusual color without other symptoms. Remember, transient changes are usually dietary. Persistent changes, more than 1 to 2 days, require medical attention. Beyond color, other critical stool characteristics. While color provides crucial information, these additional factors complete the health picture. Consistency matters. Hard, lumpy stool may indicate constipation. Loose, watery stool suggests diarrhea or inflammation. Floating stool can signal malabsorption. Frequency patterns. Significant changes in bowel habits warrant attention. The sudden onset of constipation or diarrhea needs evaluation. Associated symptoms: abdominal pain, unexplained weight loss, fever, nausea, or vomiting combined with color changes increase urgency for medical assessment. Proactive steps for optimal digestive health. While monitoring your stool is important, prevention is even better. Dietary foundations: eat diverse fiber sources, fruits, vegetables, whole grains. Stay adequately hydrated. Include probiotic and prebiotic foods. Limit processed foods and excessive fats. Lifestyle factors: Exercise regularly to maintain healthy digestion. Manage stress, which significantly impacts gut health. Avoid unnecessary antibiotics that disrupt gut flora. Don't ignore the urge to have a bowel movement. Screening protocols. Begin regular colon cancer screening at age 45, earlier with family history. Discuss digestive changes promptly with your healthcare provider. Keep a symptom journal if you have recurring issues. Your toilet bowl offers a free daily health screening if you know how to interpret the signs. While this information might seem uncomfortable to discuss, understanding these signals could help you catch serious conditions early when they're most treatable. The most dangerous approach is ignoring what your body is trying to tell you. Your action plan. Start paying attention. Notice patterns. Don't panic over single episodes, but do take persistent changes seriously. Your digestive health reflects your overall health, and sometimes the most important health information appears in the most unexpected places. If this information opened your eyes to the importance of monitoring your digestive health, please share this video with someone you care about. You might provide them with knowledge that makes a life-saving difference. And if you believe in empowering people with practical health information that can prevent serious illness, subscribe to our channel for more insights that transform complex medical knowledge into actionable wisdom. Remember, your body speaks to you constantly. Learning to listen might be the most important health habit you develop.